A day in the life of a radiologic technologist. If you're looking for a promising career in the medical industry with plenty of specializations, consider becoming a radiologic technologist. Like other medical professions, radiologic technologists have several hands-on responsibilities within a healthcare facility. In this video, you will learn more about the radiologic technologist profession, what they do each day, and how to become a radiologic technologist. Before we proceed to this video, don't forget to click the thumbs up button, share to your friends, and subscribe to Earlyseven YouTube channel for more Radtech videos. Who are the radiologic technologists? Radiologic technologists are medical professionals who specialize in human anatomy imaging. They conduct various diagnostic imaging examinations to diagnose, treat, or rule out disease or injury. Some of the diagnostic imaging procedures they perform includes X-ray examinations, computed tomography scans, and magnetic resonance imaging scans. Depending on their experience, radiologic technologists may also perform techniques like cardiovascular interventional radiography, sonography, or mammography. Radiology technicians must position patients correctly when performing any of these procedures or techniques to provide radiologists with an accurate and clear image. Having a clear image allows radiologists to determine what is or isn't wrong with the patient. Some conditions they may help diagnose include ulcers, broken bones, and cancer. Most radiologic technologists work in private, state, or local hospitals. Other places they may work include private imaging centers, outpatient care centers, laboratories, doctors' offices, or therapy centers. In these settings, they work alongside with the radiologists, physicians, and other healthcare professionals. What does our radiologic technologist do every day? While radiologic technologists share the same general tasks, their day-to-day duties may vary depending on their workplace, experience level, shift, and patient needs. Here's a look at the day in the life of a radiologic technologist and their various duties. 1. Receive instructions from a physician. Before radiologic technologists start imaging, they get instructions from a medical professional regarding what part of a patient's body needs imaging. 2. Ensure all equipment is operational. Prior to taking images, radiologic technologists need to verify that every machine they're using is in working order and capable of taking clear and accurate images. If it is not, they need to notify the right party and obtain equipment that can take images correctly. 3. Prepare patients for imaging. Radiologic technologists introduce themselves to their patient and give them a clean medical gown prior to imaging. Then, they position the equipment or the patient depending on the area that needs to be radiographed. Radiologic technologists may also have to lift disabled patients to obtain a photograph of the affected area. 4. Operating imaging equipment. With the patient in the proper position, radiologic technologists use the equipment to obtain an accurate image of the necessary areas. They follow proper safety protocols and wear protective gear such as shielding devices to prevent them from radiation exposure and other harmful energy that diagnostic technology emits. 5. Review images. After the imaging equipment takes a radiograph, radiologic technologists review the images to ensure they're clear enough for a diagnosis from a physician or other medical professional. While they don't make the diagnosis themselves, they need to ensure it's clear enough for a physician to use. If an image is not accurate, radiologic technologists take additional radiographs. 6. Print or develop images. If the images taken are accurate and clear enough for physicians to assess, radiologic technologists print or develop them through a computer printing process. If the physician needs additional angles to make a proper diagnosis, they may ask the radiologic technologists to take more photographs. 7. Clean used equipment. After the imaging process is over, radiologic technologists clean off any equipment that was used in the process. This includes imaging equipment and anything the patient may have used, such as a table. If the patient was wearing a gown, it can be thrown out or put in a container to get washed, depending on the material. 8. Meet with other patients. After helping out one patient, radiologic technologists meet with several more throughout their day, working alongside other members of the healthcare staff. 9. Perform other duties. Apart from patient-related duties, they also help with administrative or cleaning tasks throughout their workday as needed. They may also check any diagnostic machines to ensure they're working properly. Also, complete necessary paperwork, restock supplies, verify a proper supply stock in each room, and meet with a team of other healthcare professionals. Radiologic Technologist education requirements. Radiologic Technologist must have a certificate for associate degree or a bachelor's degree. When enrolled in one of these programs, radiologic technologists study various courses that provide them with a greater understanding of the following areas. 1. Patient positioning. 2. Human anatomy. 3. Radiographic technique and image evaluation. 4. Radiation physics, protection, and safety. 5. Equipment protocols. 6. Basic patient care. And 7. Medical ethics. In addition to these areas, radiologic technologists may specialize in a specific area of medical imaging. Some specialties include CT scans, MRI, and ultrasound. That concludes our video for a day in the life of a radiologic technologist. If you enjoy watching this video, don't forget to hit the like button, share to your friends, and subscribe to Earlyseven YouTube channel for more Radclusive videos.